Today we have already done an evaluation, a thorough evaluation of Melissa, and we found out some things that are very common with patients all over the world that have neck pain. Today we're going to show you 4 simple exercises, and we're going to start with the neck exercises first to strengthen the neck. Okay, so number 1 exercise, you have to have a foam roller and you have to have a head weight. This is just an ankle weight. You got to put that ankle weight on the head, make sure it's nice and tight. You got to have a foam roller. If you don't have a foam roller and you don't have a head weight, you can use a bag of rice and kind of Velcro or tape it on your head, and you can just use a pillow for a foam roller. So the thing is we're going to do is we're going to have her do a chin tuck. She's going to bring her chin down to her Adam's apple, and she's going to feel the muscles tighten up right in here. Now if she does this correctly, it's kind of like a bowling ball or a soccer ball rolling in place. Her head never leaves this, it always touches this, but it's just kind of unweighted, if you will. So if you had a scale under her head, the scale would say, okay, 20 pounds. But as she rolls, the scale suddenly becomes 0 pounds, but it's still touching the scale. Now when she rolls it up there like a bowling ball rolling in place, kind of spinning, if you will, she's going to hold that for 3 seconds. Okay, 1, 2, 3, and then release. Okay, now do you feel that working in there?
Yes.
Now you're supposed to do about 15 or 20 of them and then call it good. Now if you get to the point where you build up enough strength in your neck, that will eliminate a lot of pain. What it does is it gets you stronger, it puts your bones back into proper alignment. We know that she has some stenosis, in other words where the nerve holes come out. There's some compression on the nerves. So when she's rolling down like this and she's holding 3 seconds, she's opening those nerve holes wide open so those nerves have more room to breathe. Okay, so we've done exercise number 1. Next one is on her side, so go ahead and face the camera. You won't have somebody doing this, but you can kind of get on the floor and do this with, putting yourself up against a couch. Like say this foam roller is up against a couch or a wall. Now she's going to take and go all the way down and all the way up and hold it 3 seconds. Okay, and this hand's on her hip like this, and she's trying to keep her head and trunk in line, in a straight line, if you will. Now some of you might be saying, look, I can't do any weight to start with, weight on my head, it's just too much pain. The rule in therapy is if you have tears coming down your cheeks, it's called you're breaking the rules of therapy. Now she's got a 2-pound weight on her head. We do want everybody to work up to a 5-pound weight eventually. We've noticed over the years that people who get up to 5 pounds, they get out of pain. When I test everybody, I use a force gauge to tell how many pounds of strength that you have in your neck. And I've noticed over the years that if you get up to 40 pounds of strength in your neck or to 50 pounds, you're pain-free. Melissa, we're going to have you lie on your belly. Go ahead and put your head all the way down. Good. And then bring your head all the way up. Okay, and how long do you hold it up there?
3 seconds.
3 seconds. So this one here, for Melissa, it's not that it's really weak. Remember how strong you were? Mm-hmm. But it's more about the range of motion, and it's more about the stretching. So for her, we want her to go down. We want her to stay down there and stretch and take a deep breath and blow out and let her head fall. Now watch this. Right here, her forehead's supposed to get down to the table, and you can see we're about 3 to 4 inches away, which means these muscles in here are 2 to 3 inches tight. They're holding tension, not letting her, which is only going to compress her spinal stenosis and her disc bulges even more. On her MRI, it shows this little disc bulge pinching this nerve right here. So this is not a good situation. And also with spinal stenosis, the nerve right here gets real tight, and there's just not a lot of room for the nerve. So this is why we're doing these. We're trying to open her nerve holes. We're trying to open up this area so there's not so much compression. Okay. All right, so you understand that one. Now here's the most important one though. Okay, so don't turn off your video yet. Go ahead and lie on your back if you would. This exercise is to really stretch in right at the base of her skull. Melissa, how often do you get headaches?
Daily.
Daily, hear that? Daily headaches. Does it hurt right here on these muscles?
Yes. Okay,
you have to learn how to shut these down. We did a biofeedback study on Melissa this morning, and it was very difficult for her to relax and let go. Can you feel the pressure right on those muscles that you were telling me?
Yes.
So now we have a little unwinding technique that we've learned over the years. The rules are very simple. When you're breathing out, you move right or left. That's step 1. When you're breathing out, you move up or down. That's step 2. And then pretty soon you unwind those muscles to the degree that there's literally no more pain back there. So what you're going to do now, those little muscles we're talking about, if you want to look them up, are called the suboccipital muscles and the upper trapezius muscles. So Melissa, you have to take a deep breath. When you breathe out, you have to rotate right or left. Now the choice is made, you have to rotate to the path of least resistance. So if you rotated to left, I'm hoping that you thought, okay, that feels easier for me to move that direction. Now, at this juncture, she took the first step. She's going to take a deep breath. On the exhale, she's going to tilt the chin down, or she's going to put her head back. So she's going to go, okay, did you feel the path of least resistance down? Okay. Now, at this point, she's going to take a deep breath, and she's going to go right or left. And she's going to go as far as she can, breathing out the whole time. Now, at this point, she's going to take a deep breath, and she has a choice of up or down. Okay? And now you carry on there like that, and let's see what Melissa comes up with. This is unwinding. It's called idiopathic unwinding. There's really no more rules than just you got to breathe out when you're moving. You got to choose right or left, and then you got to choose up or down. But as she does this and then goes back to the biofeedback studies, we'll find that she's able to relax her muscles even more. So this is very important. But also she's hitting those trigger points, the suboccipital trigger points back here. Now if you find one, like say right here, are you on one pretty good there?
Yes.
Okay, so take a deep breath and just nod there. And then take a deep breath and nod back. And just kind of, and you don't even worry about the breathing for a minute, just kind of nod on it. Do you feel like you're on it, or do you want to move a little bit?
Right there.
Is that more there? And so this is a way you can work out those stubborn trigger points that have been an area where the muscles have been tight for a long time. You're not getting good blood flow. You got some adhesions that are building up in that area. It feels kind of gristly, you know, and painful. And so then come over here. I think she's telling me all of her pain's more on the left side. So I think she likes to be more, do you like to be more over here?
Yes.
Okay. And but once you learn this technique at home, you can just sort of roll back and forth on that trigger point. You can kind of nod up and down and really work that thing out. Okay, so I'll tell you the truth. We just went off the air for a minute there to check in with Melissa, and we found out that she's literally having almost no pain.
Right.
We had a lot we were going to make in this video, but I got a patient here that's telling me they feel pretty good. I don't want to give her too much to do. Okay, I can always come back onto this with Bob and Brad later if they allow me to. But at this point, we're going to call it good. You guys have seen how to get out of neck pain, and this worked for Melissa.
Yes.
Go ahead and turn your head to the right and left, Melissa. Let's just see. How's that feel?
Feels good.
When she came into my home this morning, she had a pain of a 5.
Yes.
Okay, yesterday she said it was a 7. All we did was one simple exercise. We put a weight on her head. You saw it. We had a foam roller for part of it. You can use a pillow for that. You can put rice on your head for the other part. But this is going to be a wrap for today. We're going to see if this too will get you out of pain the way it got Melissa out of pain this morning. Thanks for joining me today. Talk to you later.